Each week, 500 Americans die of prostate cancer. It's more common than breast cancer even, but it doesn't get the attention it deserves.
Now a group in South Florida is trying to change that. Dr. Arnon Krongrad is a board member with Miami's new prostate cancer mission. And doctor, what does the mission hope to accomplish?
The mission would like to reduce the burden of prostate cancer. We're going to start off by increasing awareness. That's what we did last week. Last Thursday at the Intercontinental, we had 300 people show up for 3 hours of heavy-duty intellectual lifting. It was fascinating.
Reason number one why people do not get their prostates checked.
Because they're men.
Simple as that.
I think so. I don't know. People ask me that all the time, and frankly, I'm not a sociologist, but it's fascinating to hear the explanations. Almost everybody says it's a gender difference.
And it's 1 out of 6 men will get prostate cancer, 1 out of 8 women will get breast cancer.
You got it. There's more prostate cancer than breast cancer.
But don't you think Susan G. Komen Race for the Cure has made breast cancer, there's so much awareness of it because of that?
The Susan G. Komen has set a wonderful precedent. Whether we're going to follow that model remains to be seen, but it sure is a good example.
When do you think, when is the right age for me, let's say, to get tested?
I would say if you've got no specific family history, no specific risk factors like that, probably at 40. Check your cholesterol, check your PSA. It's the same blood test. It's easy.
Okay. And what? How easy is the exam? Just it's a quick in and out.
The physical exam?
Yeah.
Quick in and out. That's you got it. That's right. About 5 seconds.
Intended.
It's all right. You got it. Yeah.
You know what, though?
See how much fun this can be.
People need to laugh about it. I mean, it's a very serious thing, but people need to. You okay?
Yeah.
People need to really. It's an exam like any other exam.
You got it. You got it. But here's the point. Here's the point. What we heard last week is vital information. We're seeing stuff coming out of Austria, which has set the standard for prostate cancer detection. We're seeing that between detection and treatment, there's a 55% reduction in mortality. That is not a trivial difference. When you're talking about the most common cancer, okay, 1 out of 6 men, when you're talking about 500 men dying every week, you're talking about a 55% reduction, 300 lives a week saved. By detection and treatment, we need to know.
And what are we? Early detection so important.
It's the key to effective management.
What do we need to do? My last question right now to get it out there to really make it more or less taboo.
Well, I think it's happening. What was fascinating about last week, an unprecedented event where you had doctors and patients talking together, what we need to do is simply perpetuate that. We need to get the women involved. If the women can do what they did for breast cancer, they can surely do what they did for prostate cancer also.
All right, ladies, sign up. We're all involved. All right, thank you so much.
You're
Very
welcome.
good and crucial information. A lot of people aren't aware of those statistics.
And what's the name of the organization?
The Prostate Cancer Mission.
All right.
PCmission.org.
PCmission.org. All right, thank you so much.